Thank you, Cathaoirleach. I wish to acknowledge at the outset the excellent work by many of the organisations and departments represented here, and I acknowledge that unequivocally. But equally so, there are opportunities where things should have been done better, could have been done better, and when not done as they should be done in terms of best practice, can have catastrophic impact. And one such case that I wish to raise this afternoon is the catastrophic impact that has been laid upon the lives and quality of life of the residents of the Skellig Star and the wider community of Carsaveen, due largely to what I would regard as very poor practice. It is my intention to proceed by posing 3 very short questions, and I would appreciate if those questions could be answered, and then I will follow my line of questioning again after that. So firstly, I seek absolute clarification on these following questions. Number 1. Did the HSE, as the Minister for Justice has suggested, fail to inform the Department of Justice of a positive diagnosis of COVID-19 at the Dublin hotel accommodation base of a large group of asylum seekers? That's really a simple yes or no. Number 2, knowing of the positive COVID-19 case, why did the HSE not authorise testing of the group before they were sent to Kerry? And finally, can the representatives here explain as to who made the decision to overrule the legitimate concerns and misgivings of the HSE Cork Kerry as regards moving a large group of people during a pandemic and moving them to a place which Cork Kerry HSE deemed to be utterly inappropriate given to its poor services of primary of care available in the area? There are the 3 questions. Thank you, Cathaoirleach.
Deputy, in relation to the first question about the informing the Department of Justice, I'm going to pass that question to my colleague Dr. Kelleher because it relates to public health guidance in relation to the informing around public health outbreaks.
When instances happen, wherever they happen, around a case being identified, the individual case is spoken to, and it is then discussed with them about who would be likely to be their contacts. And that is what happens in these circumstances. It's my understanding that the first case that we understand was transferred from there came around 12, 14 days after they moved. So it's unlikely that was as a consequence of what happened in the hotel. But even so, as a consequence of the investigations that went on by the public health people in the hotel, there was no need to speak to people outside of the group that was concerned because of the way they actually lived together in that point of time.
And the second question related to the authorisation or information in relation to testing. The testing programme for COVID-19 at the point in time towards the end of March related to people who were symptomatic, presenting with symptoms of COVID, and at that point people were advised and are advised to contact their general practitioner who will discuss their clinical symptoms and refer them for a COVID-19 test. In relation to mass testing, which is the proposal in this instance, I'm going to pass that question over to the Public Health and to Dr. Kelleher as it's a public health query.
Again, what happens is that the public health people concerned will assess the situation at that point in time and make a decision about who needs to be tested and what groups need to be tested. And that's what happened. They, at that point in time, made that decision, which is a totally appropriate decision in the circumstances.
Thank you. I would absolutely dispute, and I will, as I get the opportunity to go on, I would absolutely dispute the fact that the residents of the hotel accommodation in Dublin were not impacted by that positive diagnosis. And equally so, I'm still not clear as to who overruled HSE Cork Kerry in relation to their misgivings, but I will move on. I note from the submission by the HSE Head of Primary Care that the HSE is of the view that the first case of suspected COVID-19 in the Skellig Star was the 30th of March. Now that date puzzles me, as I have verifiable evidence of a written communication from the Skellig Star to the Department of Justice on the 24th of March, confirming a suspected case of COVID-19. In fact, the resident concerned was placed in isolation on March 20th, one day after arrival to Carsiveen. So 2 points. If the Department of Justice knew of a suspected case on March 24th, why is it the HSE was not aware of it until March 30th? And that's almost a week later. Secondly, the timeline might not be of importance to either the HSE or the Department of Justice, but it is hugely, hugely important to the residents of the Skellig Star and the community of Carsiveen. This timeline confirms unequivocally that COVID-19 was transported by bus on the 18th and 19th of March to the Skellig Star and the community of Carsiveen. I say this with absolutely no blame to the residents of Skellig Star, but I do apportion absolute culpability to the HSE and the Department of Justice for not conducting the necessary COVID-19 testing prior to leaving Dublin. To my mind, at the very least, this was a grave oversight and at worst an unequivocal dereliction of duty of care to all concerned. I wish to raise a point also regarding oversight of the Skellig Star as it currently operates. The HSE tells us, and this was made clear in previous discussions, that it advises, it recommends, it suggests regarding appropriate public health measures, but it is up to the operator to implement those recommendations. The Department of Justice has delegated operations on the ground to a private operator, in return, no doubt, for a substantial fee. But the key question I wish to pose is, who amongst you assembled here, HSE, Department of Justice, who amongst you actually has oversight of what the operator is doing on the ground? Is it the HSE? Is it the Department of Justice? Or indeed, is it neither of you? Are you aware that the operator did not appear at the Skellig Star until March 26th, some 8 days after residents first arrived? Is that oversight? Left in charge was an untrained staff, chaotic scenes on arrival on the 18th of March, no social distancing, no beds available or sufficient rooms prepared. Now, I could raise a number of specific points regarding daily oversight at the Skellig Star, but time does not allow me, so I'll mention just one. Are the Department of Justice and the HSE aware that no professional deep cleansing of the Skellig Star has ever taken place from the 18th of March to this very day, the 26th of May? And that's despite 25 confirmed cases of COVID-19. So how is it being cleaned? Well, I'll tell you how it's being cleaned. Mr. Price Star Drops. A white vinaigrette spray, which Mr. Price himself advertises as being cheaper than all the rest at €1.49 a bottle. That's what is being used throughout this entire pandemic to clean and disinfect the Skellig Star Hotel. Mr. Price Star Drops. Now, is that best practice? Is that acceptable? Is that good enough, given that we've had 25 positive cases in the Skellig Star? I have asked for an independent inspection of the Skellig Star building. Minister Flanagan refuses on the grounds of health and safety of workers carrying out the inspections. And yet the HSA can investigate more than 400 meat plants, and construction sites can be investigated for proper adherence to social distancing measures. The quality of life and health and welfare of the residents living 24/7 in an infected, unsuitable building cannot be provided for, yet all these other inspections can take place. It is utterly shambolic. It is utterly unacceptable. I ask you to do the honourable thing, carry out the inspection and close the building. Thank you. I'd appreciate any answers for the time that's left.
Well, Deputy, the first thing to say is that if you have verifiable evidence of a report to the Department on the 24th of March, we'd like to see it, because we have not been able to establish any evidence of knowledge in the Department prior to the 30th of March, when the Centre Manager reported to our daily helpline that he had one case of a person in self-isolating. That's the first we have been able to find. But if you have verifiable evidence of something earlier, please share it with us and we can then check in our own systems. We have to go by HSE advice on testing, and obviously our colleagues from the HSE have already explained the protocols around testing. So as to your view that there is culpability around lack of testing, obviously I cannot concur with that, because there are protocols around how testing should happen. With regard to oversight of the service provider, the Department of Justice is the responsible department for direct provision centres. These are our residents, these are people that we have ultimate responsibility for. Normally speaking, we would have a protocol of 3 unannounced inspections of every centre every year. That's what we aim for. It's been difficult to achieve given the numbers of centres we're now running. And of course, in the context of the pandemic, we also have to consider our own staff and their health and safety. Now, as it happens, Deputy, and you may not be aware of this, there was a member of staff present on the night the centre was opened, and in fact she herself stayed in the centre to see that everything was right. You'll be aware that there were a number of teething problems as the centre opened because it opened fast. There wasn't time to go down there and spend 4 to 6 weeks, which is the norm, making sure everything was working correctly. But that staff member made sure that the centre was as proposed and made sure that people settled into the centre, that there was heating provided in each room because the boiler, as you know, had gone wrong in the intervening time, and that the necessary arrangements were there for the centre. I also understand what you're saying about the centre staff who almost certainly had come over from their previous employer, as is the law. And obviously we also encourage centre managers to employ locally because it gives good jobs into communities. So I can imagine that those initial sessions, that initial few days, I mean, we have been very consistent. We opened this centre much faster than normal. We didn't have the time to do what we would normally do in these circumstances, and the centre manager didn't have the time.
Thank you very much.
We will continue to, we have been in daily contact with the centre manager over the last 6 to 8 weeks. I speak to the Minister every day about the Shellig Star and Cahersiveen. We have regular interactions with them. We are constantly looking at what they're doing, and we're happy that the centre is now being run very effectively, very well. There's good facilities in the centre, and we are happy that it is working well for the residents that remain in the centre at this time.
Ms. Buckley.